Welcome to the CHOW Podcast, hosted by Animal Friends of Wyoming County, where our mission is to help care for animals held by the Wyoming County Animal Shelter and promote responsible pet care in Wyoming County. Thank you for joining us.
Hello, everyone. Welcome to the new episode of Animal Friends of Wyoming County's CHOW Podcast, the greatest dog education podcast on the planet. I'm so happy to have you guys here with us. I am your host, Sam Goodell, the president of Animal Friends of Wyoming County. And today we're ushering in a brand new season of the CHOW Podcast. Joining me right to my left here is my co-host, Miss Jessie. How's it going today?
It's great. It's great to be here.
Cool. Awesome. We're really excited to get this episode started. This is one I've been dreaming about for a while, and I'm so happy we're finally able to get it done and started and everything. And before we go and introduce to our new guest, I would like to introduce another member of Animal Friends sitting right over there, Mr. Audie. How are you doing, sir?
I'm doing amazing. I'm looking forward for this podcast.
Good. Well, we're really excited. And so this is a topic that I've been kind of playing in the back of my head for about the past couple years since we started the CHOW Podcast. I personally can say I do a lot of work at a veterinary clinic, and we've done the relationships you build there with the doctors and the veterinary technicians are incredible. And to see their work ethic, I love highlighting what they do. And I finally get to have the privilege of interviewing one of my closest friends in the veterinary world. And she is a veterinary technician. I'm going to let her introduce herself.
All right. I'm Amber True. I'm glad I can make all your dreams come true, Sam, today. So I have worked at the Perry Vet Clinic for 15 years. So I came right out of college doing it. Life has changed a little bit. I'm not doing it right now, but it has always been a part of my heart. And I'm excited to share it with you guys today.
Mm-hmm.
Well, thank you. Thank you for joining us. Thank you for saying yes when I asked you, because there's a few people when you go to work sometimes that you are looking forward to see and just spending your day with. And I always love checking my schedule to see, is Amber working today? Because she's going to be the vet tech I'm going to bother with questions all day long. And I thoroughly enjoy every minute of it.
Well, thank you. I enjoy working with you too. I'm so grateful we got the opportunity to work together and become friends.
Oh, yes. Oh my gosh, totally. So tell the audience a little bit about yourself. Where'd you grow up? Where'd you come from? Things like that.
Yeah, so I've been in Perry my whole life, married and continue to be here. I grew up on a small family farm. We had some farm animals, dog, cats, all the regular. And I've just always loved animals. I've rode horses my whole life. That was kind of my MO. And honestly, when I started down this career path, I thought I would do large animal, but definitely swung towards the small animal. There's more opportunity, I feel like, and I'm really grateful I did. It's brought me some great people, some great connections.
Yeah, awesome. So besides being a veterinary technician or in that animal world, what else do you do for fun?
Yeah, so I basically cart my kids around to sports now. We're in that era of life. So I've been married to my husband for 13 years. We have two kids, 7 and 10, and they keep us very, very busy.
Awesome. Well, that is great. So we're just very excited to get things started. But before we do continue on to the main topic, we got a little advertisement we want to share with you. Since 1981, Daryl's Pizzeria has been serving the town of Perry, New York with delicious and amazing pizza, wings, and a variety of other complimentary dishes. Whether you are picking up in person or utilizing their local delivery service, you can always expect friendly and passionate faces from their staff. Aside from your traditional trademark food items, Daryl's also provides ice cream from Yummies in Warsaw, New York, as well as daily specials. Also, you can order your food online through their website too. Daryl's Pizzeria has been a constant sponsor of Animal Friends by helping us sell chocolate bars and calendars. Thanks to their sponsorship, we can further our education initiative and make more successful adoptions possible. Order from them today in person at 163 South Main Street, Perry, New York, 14530. Order online at darylspizzeria.com or call them at 585-237-2113. That's 585-237-2113 or darylspizzeria.com. Well, welcome back. Thank you so much for watching one of those advertisements. You know, those advertisements really help us fund this CHOW project, and we are so blessed to have some community supporters, that community businesses that do a lot for us. Daryl's Pizza, Pizza Depot in Silver Springs, and now we have a new sponsor, the Looking Glass Salon. So thank you to everyone who donates to the CHOW project and helps make this a reality. So thank you again, and now let's move on to the main topic at hand. All right, so being a veterinary technician, how would you, I'm trying to think of a way to, how can you sum up what a vet tech does, basically?
Yeah, so it's changed a lot over the years. So when I started, it was more of a labor-intensive job, if that makes any sense. So you did a lot of the behind-the-scenes work. You spent a lot of time in the back room that nobody knows about. Monitoring animals for anesthesia, doing that kind of stuff. As it's grown over the years, we spend a lot more time communicating with clients, which I at first was really nervous about, but have grown to thoroughly enjoy, because not only now do we have the connections with the animals, but we also have the connections with the owners. You know, it's hard. Vet care used to be different when I started. The expectations, you know, your pet used to be a pet, now it's a family member. So the job has really changed. To sum it up in one word, it would be really difficult, because it's such a big undertaking.
It is, yeah, and that's one reason why I wanted to title this this podcast "The Unsung Heroes of Being a Veterinary Technician," is because a lot of times when a pet owner would come into the vet clinic, the first thing they only are thinking of is like, I'm going to see the doctor and do all this stuff,
Yes.
but they don't really realize the team that's around behind the scenes, such as yourself, that's instrumental in fulfilling all those duties.
Absolutely, and that goes from the vet to the tech to now we have tech assistants, which is huge because they do a lot of that laborious work that we were doing before. So we're able to spend a lot more time on the diagnostic end with the owners. And even the kennel staff in the back is so important to make the day-to-day processes. Our receptionists, every step of that process that you deal with people or don't even necessarily see them is what makes the vet clinic work every day.
Yeah. Yeah, the operations, just walking in there, and if you just take a moment when you walk in as a client to notice around the room what's going on a little bit. I know we're always so focused on our pets, which is the primary reason you're there.
Yes.
But you see all the work that the receptionists are doing with answering the calls and trying to help facilitate some things, and then they communicate with a vet tech who then has to communicate with a doctor to get things all streamlined. It's quite the process.
It really is, and it's grown. Like I said, the expectation of veterinary care has grown so much, just as our pets have become more of our family members. It really has grown, and it takes an army to make it all happen in a day. And I always tell people, and I think it's always amazing to me when I walk in a room and I say we need to do blood work, and they say, okay, when will you call me with the blood work? I don't call you, just spend 15 minutes, I'm going to draw the blood right now. And they're like, what? You know, with people medicine, you're lucky if you get a call, you know? Yeah. And so I think that's really something that gets overlooked, is the quality of care you get so quickly when needed. You know, there's no waiting, and we're really able to do a lot. It obviously depends on each individual vet clinic, what they're capable of, how many staff they have, but us specifically are very capable of doing a lot of the stuff right in-house.
Yeah, yeah, that has been a huge blessing for this area. Perry Vet is a big name in Wyoming County specifically, and it's because of all the stuff that they're able to do that they've grown so much throughout the years, and even adding on new staff and new titles, which is very essential.
Yes.
So for the education of a veterinary technician, how long would you say does it take to become a veterinary technician?
So the general is a 2-year degree, so an associate's degree, but you do have to take a test at that end of that to be certified. To be a licensed technician. Some states that's not true, but that is true in New York State. So on top of being good at your physical skills, you have to be able to learn the curriculum and take the test. Some people can extend that out to 3 years. I wanted to get through college and to work as fast as I could. I never specialized, but you can continue your education into specializing as a veterinary technician, dental work and such. For me, I started a family young, so kind of went right to work. But you definitely can grow your career too.
Absolutely.
Yeah, that's awesome, and that's very commendable because a lot of people would. I could only imagine how hard it is to balance that family life with the responsibilities of like a veterinary technician and things like that. Because you're essentially, to a degree, kind of on call like the doctors are when it comes to needing help.
Absolutely.
Right?
So when I started, like I said, this goes along with the change in veterinary care. We used to do on-call. So as a technician, we didn't have specific nights. We would just, when your phone rang, if you lived close, you basically went, especially prior to family. As things have changed, they've opened up emergency clinics. So that gives people the opportunity that if we're not available, there's other people available, because the amount of care that we're able to give on an overnight is just not the same. Those emergency clinics are just like a hospital. They're there to help you when needed. There's great technicians that work at those places and keep you going, but really think of it as like your primary care doctor and your emergency room. So it's important to keep that, because as life changes, we're trying to form a better work-life balance for everybody, the vets, the technicians, the staff. So we're open from 7 to 6 most days. That's a long day for people to put in. And, when we're there, it's 100% all the time. So trying to stay focused on work when you're there is really important, but balancing that work life is also very important. But somebody has to be there those nights. So.
Oh, yeah. Yeah. And I guess a follow-up to some of this is what type of person do you think could handle the pressure of becoming like a vet tech, or what type of person would you say is like?
So the biggest thing I've learned is there's multiple personalities, and each person that has a different personality carries a different perspective in the job, if that makes sense. I am a very strong personality, I don't show a ton of emotion when I'm at work because I feel I can't. But that's me. And so in some situations, I'm the perfect person for the job. There is another girl I work with that is attached to every animal and cares for them as if they're her own. And some of the jobs are hard for her because she's attached, but people know she loves their animals and cares for them, and she does a different aspect of the job. So I would say all sorts of personalities. But you do have to understand, that you're going to have to face some difficult times. And whether you have a strong personality that doesn't show emotion, or you're somebody that shows a ton of emotion, you have to be able to rein both of those in and meet in the middle for our clients. And so being able to control those emotions has to come together.
Totally. I can relate to that a little bit because my short life being in the animal world, from not just a receptionist perspective at a vet clinic, but also in animal control, that is, if you get too overly attached to like one particular dog or anything like that, like you just said, there are scenarios that are going to come up that may not be ideal and out of your control. But if you are too emotionally attached to it, then it makes it harder for you to fulfill your job more.
Yes. So as a technician, we have to make the educated decisions. It's not always the fun decision. It's not. So not that we're not attached, and it happens. There are clients, there are patients that you just become, I can't go in that room because I can't give them that news. It happens. It happens to every single one of us. But being able to detach yourself enough to make that educated decision instead of the emotional decision that the owner has to make is really important, because sometimes they just need that person to help them walk through the process and, whether good, bad, or indifferent, to help them make those decisions. We can't do it for them, but we can advise them on how to do it.
Yeah.
Can I ask a quick follow-up question?
Yes.
Thinking about going back to education, can you talk a little bit about what you would tell other people who are considering the field what they might need to be good at in terms of academically? Like, what are your courses?
Yeah, so science is a huge one. Biology, so a lot of your sciences and biologies, and honestly, those were the hardest for me, so you struggled through.
Amen.
You have to take your core classes, your skills, that's something. If you're a queasy person, I could never poke a person. I could never use needles on a person, but animals, I've just always been able to do that. So you have to kind of understand your limitations. However, I would say I went to a BOCES program. I went to the animal science program at Genesee Valley BOCES, and I did internships. So I knew this is what I wanted to do. I always thought it was something I wanted to do, but you definitely have to get in, because some people are like, I love animals, I want to be a technician.
Right.
And you get there and it's like, this is brutal and this is hard, and I don't want to do this. So internships beforehand, I would say, are huge, because it really opens your eyes. You get back there, you see what the people are doing, and it helps you understand what actually happens and the things you're going to see. And some days are beautiful and great, and some days just really suck when you go home. So internships, I think, are huge. But definitely then once you make that decision, and I would say, plan on 2 years. You need to commit to 2 years, and that's studying hard, working hard. And then when you're done, you can go do your job.
I have a follow-up question,
Yeah,
like a
absolutely.
quick follow-up question. So, as you said, like it's for educational purpose. I just want to know, for a person who's gonna be in this profession, as you have been in this profession for 15 years, how would a typical day looks like? I know earlier you said it is like difficult to describe, but what are the basic things in day-to-day life that you do at work for them to know how it's gonna look like?
Yeah, we generally get there about 7 o'clock. So during the week, at our clinic, we do surgery every day. So any animals that are in hospital get looked at first. A doctor looks at them. A tech generally is helping, whether we need to replace catheters, we need to rerun blood work, anything like that. Then we start checking in our surgeries. So every surgery talks to a technician directly. So that way we're all on the same page of what's going to happen that day. It didn't, again, used to be like that. And sometimes, people will be like, were we taking off this mask or this mask? So we go in, we directly talk to everybody, make sure everybody's on the same page, comfortable, and then we start appointments. So at that point, we're kind of split up. There's techs that go in the rooms and stay with those doctors. In the morning, there's techs that do the surgery. So we do all the drug calculations, all the anesthesia work, all the sedation, all the prep work, and we monitor anesthesia for our doctors. So we kind of stay with the specific area we're in till the afternoon to make sure no patient is left unattended at any time. So that way we're able to kind of work through, and then it's, going into rooms, it's helping doctors, drawing the blood, all of that.
Yeah. To me, it looks like mentally and physically demanding job.
Yes. So sometimes the physicalness can take away from the mental demanding, because you get so focused on your task. So in some ways, I think that's kind of a good thing, because you just know what you have to do and you get it done. The emotional part definitely comes into play. And again, that's harder on some people than others. We all get those attachments. For me, I always tell everybody, I have, watched people suffer, and like, sometimes euthanasia is the kindest thing we can do for our animals. So that is the hardest part of the job, but at the same time, I'm so grateful that we can help them across that bridge too, and help the owners at their time of need.
No, I mean, you're talking about emotion, and some people don't have emotion. So according to you, as you work 15 years, right? So what would you say to someone, as to understand more, like that does emotions makes a job easier or hard? According to, I know there are different people, different veterinarian technicians, they'll have different experience with them, but what, according to you feel about emotions when you talk about it with the job and decision? It's a lot of responsibility.
It is.
Yeah.
I tend to focus on one problem at a time, what I'm dealing with right then, and thoroughly think through the situation. I'm a very like, this, and this leads to this. I'm not I think I've been able to separate, and I say this, and it's, it's much different. When it's my own animal, I can't think, I can't make decisions, because I need somebody to help me do that. So when somebody else is in the time of need, I kind of shut down my emotion and say, okay, this is what we're looking at, this is what we're seeing. But take into account that we do have feelings, and the vets have feelings, and sometimes I think that's forgotten, that it's your pet, but we care about you, and we care about your pets, so we want to be there for you, and we want the best for both of you. So, sometimes I think they say, with vets, like suicide rate is high. Because we take so much backlash, right? Because when you have to do those horrible things, no matter what, it's your fault, right? Because somebody needs somebody to blame, and that's just how it goes. So sometimes you have to shut down those emotions and allow yourself to be the person that they can blame, because just need that, and that's what they need in that moment. And so I think a highly emotional person struggles with the job more than somebody that can kind of shut it down, because it's a hard job, and it takes a toll on you.
Yeah, because in real life, I'm a very practical person.
Yes.
You know? It also, like, if you lose emotions, also what you've been through in life, you know, you have to see that every day, and you know what works best for you. So you know, if I put too much emotion, I cannot work best out of you. Right. I get that
and
part.
I don't mean to make it sound like there's no emotion, because I do, you know, I care, and but my emotions can't matter at the time when somebody else is having their you know, whatever's going on that day.
I agree.
I'm sure, just like how you already described, like when someone is going through something like euthanasia or something, that it's already a heightened emotion for the pet owners themselves. So you trying to be that balance in the middle of helping them cope with it and go through the process, while also helping the veterinarian facilitate the process. It's a necessary bridge right there that's needed. So. Absolutely. And we work with the vets a lot more now going in the rooms, which has really created a really good relationship between clients, techs. I remember when we started going in the rooms in pregnum, you'd walk in, and Dr. Minster was one of our main doctors that everybody loved. Dr. Liz Wolf, you know, where's Dr. Minster? Where's Dr. Wolf? Who are you? You know? And now we walk in, and it's like, hi, how are you today? I saw you last month, you know? So it's really cool to start forming that relationship that the vets had with the clients before, but we're starting to get that side of things too, which is really nice. I relate to that, getting just as a receptionist, getting a client to the room. They're like, oh, you're the vet tech that's taking care of me. And I'm like, oh, don't give me that honor. I haven't deserved that yet. I'm just the receptionist. I'll get you your vet tech. So.
Absolutely. I mean, that leads to my follow-up next question, that you said that you have better reputation, or, you know, connection with the client. You know them better, and they've started recognizing you. So that leads to my next question, like how the organization and teamwork work in a vet clinic, which, you know, creating bonds and having, you know, speak to, you know, clients, and then get back to the veterinarians and, you know, all the doctors. So how that works, like organizing teamwork in a vet clinic?
So it starts when you come in the front door. You'll meet reception staff. They'll get you checked in, get your animal weighed, make sure we're kind of covering everything that they want covered that day. Then the receptionist will put you in the room. A technician will come in, go over kind of your vaccines, kind of like a nurse when you take your kids to the doctors, kind of go through everything, and then the doctor comes in, does their work, figure out what needs to be done, and then generally we do the tasks. You know, the doctors will do vaccines or whatever, if there's any blood work, nail trims, anything like that. Then we bring them to the back, generally away from owners. People don't believe it, but their dogs are calmer. Just because you're in a small room, you know, you're putting the owner in the corner, and the animals they want to protect their owners, which absolutely they should. So sometimes just getting them out of that situation into a bigger room. So we'll take them in the back and do that kind of stuff, and bring them back to the clients, and then they meet the reception staff up front again, and go on their way.
That's great.
That really is like an appointment in a nutshell.
Customer service and, you know, building reputation with the customer, so they want to come and they want to be happy about it, not, you know, skeptical of what they can do and all that stuff. I think it really matters.
And a friendly face. I cannot tell you the number of people that name a receptionist, this is who I want to talk to, because I know they know me, they know my pet, and I just want to talk to them to book my appointment, because that's what's comfortable, or a specific doctor, or a specific tech. So I just tell everybody, like, obviously in an emergency situation, like, just get help. But if you want to come in and you want to see somebody specific, it's okay to ask.
Yes, I agree.
Oh yeah, the comfortability is key to getting any of these problems that your pets have solved too.
Absolutely,
Like,
absolutely.
Yeah. So you explained to some of the things of your main duties that you like drawing up blood work, assisting the vets. What are some of the things that you would say, especially to your average client, pet owner, who thinks, oh, the vet tech can just do this, the vet tech can just do anything type thing? What will your limitations be before it gets to like needs a doctor type thing?
Yeah, so we can kind of help, and this has come with time also in working with doctors that we're comfortable with, so that relationship goes a long ways too. So I've worked long enough with certain doctors, I know what they're going to ask for based off of the symptoms I'm given. At any point, if I am not confident in what I'm hearing and seeing, it's not lining up, I'm going to back out and say, I'm going to have the doctor come in and talk to you first, and we'll make decisions from there. Or if the people just aren't sure that's the route they want to go, I'm not the final say. So I'm going to say, this is what I would suggest, think about it, and we'll have the doctor come in and talk it over with you too and see what kind of plan we can come up with. Rabies vaccines specifically have to be given under the direction of a doctor. Anything surgical gets done by the doctors. We do a lot of dental work at the clinic, so we can do all the cleaning, the prep work, the x-rays. The doctors come in and do surgical extractions because, again, those are considered surgical, so anything within that range, it's really important. And a lot of times, if it's a euthanasia, we try to have the doctor go in first just because nobody wants to see multiple people on the worst day.
Right.
You know, so we try to keep one face, same thing. If a technician goes in to assist, we try to keep the same technician going in just to make it a little easier so they're not meeting 50 people on that day.
Yeah.
So that's really an aspect. And with that being said, the doctors can go in the rooms first. They have done that for years and it was always fine. It's just a way to bridge that gap and keep things moving smoother for everybody involved. And honestly, sometimes a client comes in and they say something to me and then they have a conversation and then the doctor comes in and they're like, I forgot to tell them. So it helps give them time to remember everything because sometimes those little details or I ask a question different than the doctor does. But as far as limitations, the doctors really have to be there to supervise everything we do. And we do a lot of communicating. We see an appointment come up. This is what I'm thinking. What do you think? Then we go in and have those discussions with the clients and kind of make a plan from there.
Oh yeah, because I'm sure the clients would look at you and say that because they think you're the vet tech, you're the professional. Can you diagnose my pet? And be like, well, you could give me the symptoms, and I can in my brain think, oh, I've seen this before. It could be this, this, and this. But at the end of the day, you're communicating with your doctor to make sure it's correct.
Yes. We never diagnose. That's always the doctor's job. I can throw out, it looks like maybe we've got this going on and this is why I think we should do this. But after we run all the tests, the doctor's going to look at it and we're going to try to figure out a diagnosis. And sometimes you don't have a diagnosis that day. Sometimes it takes other tests or some time to work through things. But it's definitely a tight relationship between the doctor and the technician that you're working with that creates, the whole, your day, how that day went for you at the clinic. It creates that atmosphere for you.
Yeah. Oh yes, totally. And what would you say would be like some of the benefits you've experienced of being a veterinary technician?
I love the clients I meet. I am one of the technicians that go in the room and always have the doctor come in behind me because I've been in there talking too long. So I love that aspect of it. I love the animals. That's why I went into it in the first place. It's so rewarding. I think, so there's differences in emergency care and general practice. I love general practice because you get the follow-up. So this dog came in sick. It was hospitalized. Now it came in next week for its recheck. We get to see how it's doing. We do the follow-through. With emergency care, you don't get that so much, which I assume, I have never been in emergency care. It's insanely rewarding because it's quick work all the time. You're saving lives, right? But I do like that aspect of general practice is that we get the follow-up. We get to follow those animals. I see them as a puppy and I see them their last day on this earth. And it's really an incredible ride with these clients. It's really just the whole aspect. And because you work so hard and it's such a stressful job, you make such great bonds at work with the people you work with. Like, those are my friends for life. It just, because you're living those lives together all the time.
Yep.
Right.
Yeah, you're sharing experiences no matter what level or tier you are on the totem pole at the clinic.
Absolutely. It doesn't matter.
Yeah, those lines are blurred because you're all under the same thing.
Yes, and you're all there for the same reason.
Yeah. Have there been any dangerous situations or scenarios that either you yourself have found in or you've seen vet techs can be found in?
Yeah, so absolutely. So there's been bites at the clinic when I've been there. I always tell people, I expect the dog to not like me when it comes into the clinic, right? Like, it's like a kid going to the doctor. They come in, this person picks at them and pokes and prods, and they're uncomfortable, they don't know me. Being able to handle and manage your own animal and know their boundaries is huge in our safety, our doctor safety. You know, I always tell people muzzles scare people, but it really keeps us all friends, is what I say. You know, it's nothing scary. It's just that your dog's scared, and we need to keep ourselves, including yourself, in a situation that keeps everybody safe. It keeps your dog safe, or cat, or whatever, safe during that time. And if you can't control your dog, it makes it really hard for us to be able to do our job properly. So allowing us, if we walk in the room, your dog's a little snappy. Hey, my dog was snappy last time we were here. That information is crucial for our safety. I've had some animals come in that are not controllable by owners, and it can be a very scary situation.
Yes, it's just part of proper pet ownership too, is just knowing your dog enough to know what the limitations are when you leave your house.
Absolutely.
So,
absolutely.
vet
And being able
appointments,
to control them. Yes. And like I said, I expect animals to be scared when they come in the clinic. We try to make it a situation that's as calm as can be. We do treats. We keep everything as low key. People are quiet. The fewest people we can have dealing with the situation. But at the end of the day, knowing your dog's tolerance level, you know, there's some dogs that come in and wouldn't bite a person, but they were hit by a car, and they are so painful and fearful right now that it's just a different situation than they're normally in. Sometimes they bite their own owners because they're so scared. You know, but giving information up front, if your dog generally is just not a fond person of other people, like, just let us know, and that's okay. But being able to work together with the veterinary staff to allow proper restraint, and you know, sometimes you just got to do things a little different way to make it safe for everybody.
Yes. And to that point, if say your dog is like a angel at home, and you know he's a demon at the vet clinic and things like that, don't be frightened when they ask to put a muzzle on him for poking, prodding, the vaccines, things like that. It's not a sign of he's a bad boy.
Absolutely not.
It's pure a safety reason for the dog and everyone working around him.
And it takes one quick misjudgment on an animal's part, not because they're bad animals, because they're nervous and they don't know us. And you know, like I said, I always say this keeps us all friends. It's just a safety net. And honestly, I always say sometimes it just makes them think about something besides the needle they're getting, you know, like with kids, sometimes you poke a different area to kind of distract them from it. So it's not a, you know, bad stigma around it, or it's nothing, it doesn't mean anything bad. It just is really a safety net for us and for them, because now if your dog bites me, I'm unable to treat them. You know, where if I put that muzzle on, I can do what I need to do and keep your dog safe and treated the way it needs to be.
And some of the main duties the vet techs do, I know just from experience, is that whenever anal glands, nail trims, things like that come up, the veterinarians, of course, they can do them. But the vet techs can take on a bulk of that work, because that's, and so getting, how do I say this properly? Touching your dog's feet when you're at home and things like that to get them used to that interaction. Desensitizing. Yes. That goes a long way, because they're already going to be stressed out going to the vet clinic to get their nails done. And we don't want anyone hurt in the process. And even your dog, when he struggles, he could get himself hurt. So taking those preventative measures.
And honestly, a lot of times people say, you know, they're bad at home. They know they can get away with it. You know, there's multiples of us there to help restrain and give treats. And, you know, like I said, we try to make every experience the happiest we can for each animal, because the better experience they have this time, the more excited they're going to be to come back next time. But sometimes they just don't feel that way. They're never going to be excited to be there. So just making it as quick and easy for them as we can is super important. And sometimes that even means a little sedation to help them relax, you know, just like us. I know there's some people that have to take a little medicine before they go to a dentist appointment. Like, that's okay. There shouldn't be a stigma around that either. You know, it's okay if that's what they need. And it takes stress off of them. It takes stress off the owner, because it's no fun taking an animal to the vet that you know is already nervous. So if you feel that something like that can help, don't be afraid to say, hey, I really would like to try something to kind of relax them before we come in. The options are a lot bigger with dogs than they are with cats, but there are cat options out there as well. So I think communicating with your vet, like, I don't like coming in because this is traumatic for me and him. Let's see what we can do to work together and make this, easier for everybody.
Yes.
Yeah.
I'll be the first to say I have a 12-year-old pit bull mix, and as she's gotten older, she has gotten very feisty at the vet.
Yeah.
So she is one of those concoction dogs where she has to have a special mix before we go.
Yeah.
Because she turns into someone I don't even recognize. when I
Absolutely.
walk in the door.
Absolutely.
And it's like, who is this dog and where did she
Right.
come from? But she also had a cancer and a couple surgeries and mass
I see.
removal.
Yes.
And so I feel like she associates a little bit of trauma
Right.
with like going
Yeah.
through the doors. And so
Well,
it
and
helps
even
a
if
lot.
it's not a bad experience per se, they have a mass removal. It's painful. It's just like
Right.
us having surgery. There's some lingering effects of that. The anesthesia, they remember that. And so we try to make every experience as good as we can, but some experiences just like us aren't going to be fun no matter which way you spread it. But being aware of that and doing something for her is so important, because then it makes your experience and her experience better when you go.
For sure. It's made a huge difference. Even at, like you said, my own anxiety
Yes.
walking
Yeah.
out the door because I was nervous that she was going to be reactive.
Oh, yeah.
And
And one of my kids hated shots. So before we make a doctor's appointment, I was sweating before I even called because
you can feel it. Yeah,
it's your
and they can feel
reaction.
it.
Yeah, it's your reaction. So just taking those measures, but we don't know, I might just assume your dog's like that at home too. So this is just normal. But if you speak up and say, yeah, this isn't normal. What can we do to bridge this gap? Then we're able to step in and help with that.
Yeah.
Yeah, communication is a
Right.
big key between not only, of course, the vet techs and the doctors, but also the owners and the vet techs, the owners and the doctors.
Absolutely. And with that being said, I think it's important to, having a routine vet. You have a routine doctor you go to. So trying to go to different vet clinics. Obviously, in emergency situations, you got to do what you got to do. But having that relationship is so important. One, because we know how to handle your animal. Two, we know what the normal is. So having a relationship where you go in every year just for your wellness exams and keeping that line open is extremely important.
Yeah, I mean, I have just a question. Like, as we were speaking earlier about dangerous scenarios. So, in the past or in your 15 years of experience, there have been a time that was like you would never expect that dangerous scenario to be happened in real life, and it had happened that you would never imagine. Oh, it could happen in this field. I never imagined it could happen in this field, like dangerous scenario.
I think we all expect to get bit once or twice. But I can remember a time. You do. Eventually, it's going to happen. It's kind of one of those things.
It's almost inevitable.
Yeah, it's going to happen. So it's just kind of when it's going to happen. The more conscientious you are about things. So newer technicians, if I could tell you anything, is if you're uncomfortable, get help, because there's 100 other ways to do it that you just haven't learned yet. And you get somebody with some experience and they do it this way and you're like, oh, mind blown, that just changed my life. I'm going to do that different from here on out. I guess probably one of the scariest times I had, we were actually breeding dogs in a room.
Oh.
And one of them had a muzzle on and the other one walked up to me. And I pet it and it latched onto me and would not let go. And I was like, what just happened? So yeah, I mean, I am a little more trepidous with animals anyways. When I was 16, I got bit by a German Shepherd and it was my best friend's dog.
Oh.
So I tend to be more on the cautious side of things anyways. Some people are very brave. They're like, oh, this dog's barking, it'll be fine. And sometimes it is.
Yes.
Sometimes it's not. Definitely, anytime you go back in the kennels, if there's questions, get help. Being in a kennel with a dog that does not like you is probably one of the scariest situations you can get yourself in. Sometimes it happens and the dog was fine and you didn't know it was kennel aggressive, and all of a sudden you find yourself in that situation. But you learn from your mistakes, so you learn to open the doors certain ways. I'm sure you guys deal with that here too.
Yes. From our mistakes.
Because sometimes a great dog is terrified in a kennel and it's a completely different animal, just like coming in. So just learning to not put yourself in those situations, and some of that just comes from experience.
Yes, exactly.
And yeah, you know, I'm sure here you did that.
Yeah, I did.
Oh, yes. Yeah, I just took in the dog a couple days ago that was running loose, and he seemed fine and happy. He's a German Shepherd that's back there currently, and he did not want to get in the truck. And I thought, you know, I'm by myself. At that time, I didn't have anyone that I could just call upon. So I used the rabies pole, got him into the car. I don't like using the rabies pole since it's a last effort resort, but at the same time,
but sometimes it's necessary.
Yep, and he is probably the sweetest dog ever, but like you said, he's in the heightened fight or flight mode, and he has every right to defend himself.
Yeah.
So I gotta defend myself and make sure we're all safe, and it's just part of the job usually.
Absolutely. Well, and it does no good for anybody to get bit. In the end of the day, you know, owners aren't happy when their dogs bite you. It upsets them as much as it upsets you. Probably, honestly, it upsets them more. So if we can prevent that from happening, you know, even I try with people like, I'm not comfortable handling your dog without a muzzle. And even though they're like, I don't know, like, just, you gotta trust me on this. And if it makes the situation worse, then we'll go a different way. You know, we'll use sedatives. We'll figure something else out. But you really gotta trust the team you're working with because they're there to help you.
Yeah. So, in light of all that, would you say it was worth the work and the wait and the patience to become a veterinary technician?
Absolutely. I love it. So like I said, I've been out of it for about a year now. It'll be a year in April. I miss what I do every single day. I miss the animals. I miss the clients. I absolutely would go back if life changes in a heartbeat. And, you know, if I could go in one day a week and do it, it's really a rewarding job. It is absolutely not for everybody. So I always like to lay out that disclaimer, like, I love animals, so I want to do it. That's not necessarily do your internships, do your research. But I absolutely love my job. I love my coworkers and would do it over again.
One thing that I know we had talked about before, how to become a veterinary technician and what your process was like, but after you become a veterinary technician, the education part is never over. And can you explain what that's like?
Yeah, so they've changed that over the years as well as everything else. So after you pass your exam, every 3 years you have to renew your license. And this actually goes for vets too. I'm not sure that it's 3 years with them. I would have to look into that. But with technicians, it's 3 years. The first one you get a pass because you've been in college.
Right.
But after that, you have to do continuing education programs. And basically, that's just keeping you up to date because like everything else, the medical field is always changing. The way we do things always changes. There's new medicine, there's new methods. So doing that education, we're required to do part of it in person. You can do some online, you can do it all in person. We do get offered great places to go to do some of these CE learning things, but it's definitely important to keep up your education and continue learning. Sometimes the clinic will hold them, which is really cool, to kind of sit down with the same peer group of people that you work with and hear the same information. A lot of times after we go to continuing education, we'll sit down as a group and kind of share what we learned and, you know, see what benefits us. Obviously, everything doesn't work for one clinic that's shared, but a lot of it can be helpful, or even little bits. Like I said, sometimes you learn something, you're like, I'm never going to do it that way. Like, this is amazing. So I think that's a super important part. I think it's important for us. I think it's important for the doctors to just continuously be learning. And our doctors are great about educating us as we go. So when they're looking at an x-ray, they're explaining what they're seeing. When they're looking at an ultrasound, when they're looking at blood work, which makes me better at going in rooms and saying, this is what I think we need to do because this is what they taught me. So they're great at sharing that information too and making us better technicians.
Awesome. All right. Well, I think does anyone else have any other questions before we move on to the next phase? All right. Well, we have some questions from our members and some community members as well that we would like to ask you and get your 2 cents on. Before we do that, though, we're going to take just a quick break. Thank you so much for staying with us, and we'll be right back. For over 30 years, the residents of Silver Springs, New York, and all surrounding areas have had the pleasure of indulging in deliciously crafted pizza from Pizza Depot. This small business pizza shop has become a staple in the area, known for its hospitality and excellent comfort food. They have a variety of popular foods, such as subs, paninis, burgers, chicken fingers, wings, salads, and of course, pizza. Pizza Depot has partnered with Animal Friends of Wyoming County in supporting our mission of sponsoring our shelter dogs. Thanks to Lisa and her team, we have been able to sponsor more successful adoptions. So next time you have a hankering for good pizza, consider Pizza Depot in Silver Springs, New York. Their prices are very affordable and food will always bring a smile to your face. Their address is 130 North Main Street, Silver Springs, New York, 14550. Their phone number is 585-493-5699. That's 585-493-5699. When you place your order, tell them Animal Friends of Wyoming County sent you. Pizza Depot. My mouth is already watering. Welcome back, everyone. Thank you so much for joining us on this episode of the Animal Friends CHOW podcast. So we have guests LVT, Amber True. So we're going to go on to some of our questions and answer period on the podcast. I'll start off with the first question for you. Emily from Rochester would like to know, how does the role of a veterinary technician evolve with the advancements in veterinary medicine, and what continuing education do you pursue to stay current in the field? We kind of just talked about that a moment ago, but is there anything in particular?
Yeah, so kind of like I said before, it's changed just by how people look at their animals. You know, they're not pets anymore, they're family members. Same for mine. But so it changes the way we do medicine, the care that we give. It has definitely evolved. And again, being able to run the blood work in-house and having it print right there. Since I've been there, we've gone from regular, so what you think of like an x-ray sheet, it's all digital, so it goes on the computer. That makes it super easy if we need to share the imaging with a different specialist. It's easy to take retakes, so we're not sitting there taking x-rays over and over again and hoping that they came out right. It's like, oh, this one didn't look good, let's take it quick. This is what we need to do. Same with dental x-rays, that went to digital. I would say probably the dental field has grown the most with technology. We used to do like a dental or two every couple months. Now we normally do one every day, just because we're learning that heart health and all of that goes along with dental care. So we x-ray, full mouth x-rays on everybody. We never used to do that because, again, when we did regular x-rays, it took so long and it was so hard to get good imaging. Now with the digital, it makes it super quick, so the animals aren't under anesthesia very long. So our ability to do that has really grown. Our monitoring abilities, just everything that improves just keeps making it better and better. And as far as continuing education, I would say it's kind of your interest. So you'll find that different technicians kind of center around certain things. So I really got into the dental stuff. I love doing dental CE. I like urgent care CE. I actually like emergency cases that come in. I like being under that pressure. So it's just kind of what you're interested in. It just has to be within the field.
Well, thank you. And
so the next question comes from Sally from Silver Springs. What is the biggest difference between working with pets in a clinic versus a shelter setting?
So if I'm being completely honest, I have never come into the shelter to do any work as far as that goes. I would say some of the most rewarding work I do is the animals you guys bring into the clinic, because I love to hear their stories. Sam will ask you, I'm always like, where'd this one come from? What happened? I want to hear its story. And then when it gets a good ending, it's absolutely incredible. Where most of the animals we're dealing with in the clinic already have great homes and great owners. That's why they're there. So I love them both, but I do find it really rewarding working with your guys' animals just because I love their story. I don't know, it's just fun.
Yeah, and our stories here, they could vary. Some of them are just, they're pretty cut and dry, simple, like a dog was surrendered for this reason or whatever, but then as with all shelters go, each dog does have its own unique story of why it's a stray, or how we got it, or we get it in bad condition, so we take it to the vet where someone like you would treat it. And that's one of the most rewarding parts, I'll say, for the animal control perspective, is having that relationship between the vet clinic and the shelter, because we can be able to just send a message to them saying, hey, we got this dog in, we're going to schedule an appointment, we need you to take a look at it. And then it stays here for that time period while we're looking for a forever home. And so what the part of the reward is a couple weeks later, you see that pet and it's made a complete 180 of whatever illness it was.
Absolutely. And honestly, there has been definitely a handful that have gone to people at the vet clinic because we fall in love.
Yes.
Because they come in and they're just so excited to have that love again. So like I said, I haven't been here, but I can imagine why you guys all do this because these animals are just so excited to have people that love them. So it's fun to see that at the clinic too.
Those are the easiest adoptions because part of our adoption process is vetting the people, make sure they're ready for a dog. As soon as a vet tech, especially, or a veterinarian, they're like, oh, I might be interested in that one. We're like, take it. Because we know you're going to get great care and great people. And so it's just
well,
amazing.
then I think you guys get to see it too. So then
We
it's
do.
fun to be able to follow their life journey.
Oh, I love getting the follow-up messages and be like, oh, this is how he's doing at home. Be like, oh my gosh, it's so good.
Yeah, no, I love that part of being at the vet clinic. Or when they post, you guys post a video and I'm like, oh, this is that dog.
Yep. Awesome. Well, do you have a question for Ronnie?
Yes. Kelly from Warsaw, New York is asking a question to you that do you find there's enough awareness about the critical role you play in animal care? Which is also my personal question too, because it aligns with what I was thinking. 'Cause I was very less knowledgeable about, veterinarian technicians. So it kind of, because I didn't myself think that there's not enough awareness about their role in animal world or animal care.
So I would say it's the awareness has become bigger now just because our role has changed as far as going into the rooms, becoming face-to-face with clients. I also think the role within the veterinary world has become more appreciated.
Right.
The pay is better. I have to be honest, Perry has always been great, taking care of us. So that's never been, but just the industry, the pay has gotten better at every single clinic that a technician works at because, really it's getting to the point, just like doctors and nurses, like they wouldn't do it without us. It's becoming a necessity instead of just a convenience.
Yeah.
So I would say it's becoming more aware, but I would like it to continue and people to be educated on it.
Yeah.
Sure.
All right, so let's see. Lori from Castile would like to know, how can the industry better support veterinary technicians in managing stress and the workload?
Yeah, so I think the industry is starting to do that. Changing work schedules has been a huge thing. Work-life family balance. When you were a vet, you were a technician. That is why you saw men in the veterinary role, because they worked all the time and their wives were at home because that's just how it was. And as the fields have evolved into more women doing it, the technicians being more involved, they're the caretaker and the provider. So how do we balance that? And that's different schedules for us, not doing the on-call. When you have a baby coming in the middle of the night, just isn't. So we've opened up the emergency clinics. They're doing different avenues to help these animals. We want to make sure they're taken care of all the time. But how do we make it so our techs and doctors aren't so burnt out that they can go in the next day with a smile and enjoy their job?
Yep.
And be the best they can be for you. So I think the biggest thing is cutting back on the on-call, the hours, doing some flexible hours, part-time stuff. I think that's really already started though.
Yeah, well, actually, to follow up from your point, you found some interesting data regarding vet techs and things like that. Do you want to share that?
Yeah, according to just recent statistics, it stated that vet techs are 88% female.
Oh.
So it's the overwhelming majority of individuals in that particular role.
Yeah. Yeah, I am not sure. So we do a lot of internships. We've had a few men come through, but I don't know that we've actually ever employed a male technician in the time that I've been there. Just, they're not looking. I think a lot of men go on to be doctors. It was one of those things always in the back of my head, but I wanted to start a family young and I didn't want to have that much education and then not work all the time. So I think that's some of it, but it does make back-breaking work. I mean, women are strong, don't get me wrong, but sometimes just picking up these animals can be super helpful. As Sam knows, sometimes we go get him for help. But it's definitely, and even the vets, it's becoming a female-dominated field.
Yes, it is.
Yeah. That's very true. I can't even think of one male veterinary technician that in our area, or at least because I only just worked within the peri-vet practices, there's not any that's come through that's either in training or currently
so
is
I
one.
went to Alfred State College, and I graduated with 2 men in my class, but they both went on to be vets.
Sure.
Yes, yep. And I think we've had a few that have interned, but nobody's ever been hired in that facet. So it definitely is
A female dominant.
Yeah, for sure. But it makes it hard because then everybody has families and you're all trying to circle around each other to make it all work.
Yes.
All right, you got a question for him?
I have next question from Lisa from Leroy. What challenges do veterinary technicians face when working in underfunded or rural clinics?
So that one I would say, so we have 4 locations, and every location we have is different, but it's based off of the clientele we have come in. So it's what people are able to do. And so I think what's important to remember as doctors and technicians, we come in and we give you the gold standard. Nobody judges you for not being able to do the gold standard, right? Like, we understand life happens. It is very hard to watch somebody that loves their pet that can't afford to do the things they need to do to take care of them. As a technician, that is probably one of the hardest things to deal with. So there's ways around it, right? You can do different medications, different treatments, but in some places that stops your ability to care for that pet, and that just really stinks. So I would say coping with that is probably the hardest thing.
Yes, very true.
Well, thank you for that question. Thank you to everyone for these questions. I think most of them have been answered throughout the podcast, and the ones we needed to get to have been brought up now. So I want to thank everyone for submitting your questions. If you would like to have the opportunity to submit questions for future episodes, become a member of Animal Friends is one of the perks of being a member. Is you get to ask a question to our guests. So it's just $15 a year, and it gives you some exclusive things like a behind-the-scenes peek, what the Animal Shelter in Wyoming County is doing and what Animal Friends is doing, and then this amazing podcast. So, in conclusion, is there anything, Amber, you'd like our audience to go home with or to remember most about the main topic here?
I think just, appreciate your technicians, appreciate your vets, know they're there for you and your animals. And, ask questions. If this is a career you're interested in, do internships, ask questions about it, meet people that do it, because some people get in there and don't realize they have to touch poop for a living,
Yes.
We've had people intern that are like, I refuse to do that, and it's like, this is half of my job. Ask the questions, know what you're getting yourself into, because nothing is worse than going to school and then deciding it's not what you want. So do your research, but it's a great job. It's a great community of people, and I'd suggest it if it's something you're interested in.
Yes.
Awesome. Well, thank you so much for coming and being a part of this podcast and coming on board. Your insight is grateful. We're very appreciative, I should say, to this. This has been a fun adventure for this thing.
Thank you. I'm very grateful to be here.
All right. Well, thank you to everyone who's been watching the episode. If you like what you see here, please subscribe to our social media accounts. We definitely need that. And thank you for all of our supporters. And until we see you again. Have a good day. Good day. Oh my gosh. Have a good day.
Thank you for joining us on this episode of the CHOW Podcast, hosted by Animal Friends of Wyoming County. To learn more about us, visit our website at www.animalfriendsofwyco.com. And if you're interested in adopting a dog, please call the Wyoming County Animal Shelter at 585-786-8938. This has been a production of Knox Luna Films, LLC.